Morning and welcome to our Coffee Talk Health Industry Seminar Series this morning on virtual care, a legal checklist. I'm Karima Kanani, a partner in our health industry group, and I'm joined on the line today by my partner, Kathryn Frelick. And together we'll be talking to you about virtual care and providing a legal checklist that you can take away as you're looking at implementing virtual care initiatives in your organization. Before we dive into the material for today, just want to clear some housekeeping matters at the outset. All of your lines have been muted. We have a significant number of participants on the webinar today, so we would kindly request that you leave your lines on mute so that all of our colleagues can hear the material clearly as we go through the webinar this morning. Given the number of individuals that are participating today and the amount of material that we do need to cover in the short time that we have together, we will not be holding a Q&A session at the end of the session today. However, you're always welcome to send in your questions, and our full contact information is on the slides, and we would be pleased to respond to you. So that housekeeping aside, what is our agenda together this morning? Looks like a short agenda, but we actually have a lot of material to cover together. First, we're going to take a few minutes and talk about what do we actually mean when we're using the phrase virtual care and how is it intended to apply. And most of the time that we'll spend together this morning, we're going to take you through a legal checklist. And the intention here is to provide you with something that is very practical, that you can take back to your organization as clear action items that you can pursue in looking at any virtual care initiative. And we'll go through 6 different items on that legal checklist with you. And then last, but certainly not least, we'll do a brief summary and wrap up of where we've been together this morning. Is virtual care? Virtual care, also referred to telehealth or telepractice or digital health, is not a new concept to most of us. In fact, even though it seems like it was a long time ago, it was only a few months ago that we were heavily in discussions across the province on system transformation, a key component of which was the development of digital health plans within Ontario health teams, looking particularly at virtual care options as well. That activity has, of course, become accelerated in the environment of COVID-19 as there is greater separation between clinician and client and patient, and we're all looking for ways to accelerate innovation to be able to bring care to patients as needed. Virtual care really just refers to the use of information and communication technology to deliver healthcare services from a distance. There are lots of things that can fall under that umbrella, and virtual care can be asynchronous or it can be together in real time. So we may be looking at things like video or other audio technologies, remote monitoring, and other forms of electronic communications that enable you and your providers to connect with patients and clients through the use of technology when you're not in the same physical space. A short and quick note about electronic communications, because this is a question that often arises as we're looking at virtual care modalities, is the use of text and email. Now, text and email may be used to provide or support virtual care. It's not generally recommended for delivering healthcare unless there are some additional protections that are in place. These include things like strong encryption, individual consent to that specific use of virtual care modality, with an understanding of the risks that are associated with text and email, as well as it being clearly supported by organizational policies and processes on the how and when. And Kathryn's going to be speaking to you today in more detail about the development of virtual care policies for your organization. More often than not, the use of text and email is in a supportive capacity to more direct virtual care in synchronous real time, and it can be used for things like scheduling, the provision of information about the services, programs, and conditions that are associated with the delivery of care in a virtual environment. Now, just because virtual care is something that the organization makes available doesn't mean that it's appropriate to use those types of modalities in every instance with every patient or client. And so it's important as a threshold consideration and a consideration throughout the delivery of care using these modalities for it to be considered whether it is appropriate for every patient or client or type of encounter. And we've listed some considerations, not comprehensive, but an example of considerations that you want to keep in mind when you are determining whether or not it is appropriate to use virtual care. These things will include what is the healthcare status or need of the patient or client? Are there limitations that are inherent in the use of the technology or the ability of your patients or clients to effectively use that technology to receive care? Are there physical, cognitive, or sensory deficits that may make it unsafe or ineffective for the patient or client to receive care in that manner, or which may require additional resources or communication supports in order to deliver virtual care? And what technology do you in fact have available to you? And what is the quality and ability of that technology, as well as of your organization and your providers to deal with adverse events or technology issues as they may arise in the course of delivering care? Now, these considerations around whether virtual care is appropriate are ones that the organization will need to consider at an organizational level, but importantly as well, that each provider who's delivering care will need to consider on the front line at every instance. And it is the organization that is ultimately responsible for the delivery of the virtual care services. What is going to be provided by the organization and how is it going to be provided? The standard of care for delivering services through virtual means through the use of technology is the same as when delivering in-person care. And it's the health practitioners on the front lines that must use their professional judgment to determine whether it's clinically appropriate. And those are the considerations that we just went through together. In fact, health practitioners are subject, each of them, to their own regulatory requirements that they must follow in order to be delivering virtual care in a manner that complies with college guidelines. And Kathryn's going to be discussing that with you in more detail today as well, because it's an important consideration. Ultimately, as an organization, you are responsible for the care, and so you will establish policies and procedures in order to create an organizational standard for the delivery of virtual care services. When you're doing that, you'll need to take into account various risks and requirements from both the organizational perspective and also to be able to support the individuals who will be delivering the services on your behalf. So, having done a very brief introduction on what is virtual care and how it can be used within the organization, we're going to spend the rest of our time together this morning going through a practical legal checklist that you can take away with you on what are the action items that you want to ensure your organization has addressed in pursuing any virtual care initiative. Now, in this time where organizations are moving very quickly, we often get asked the question, do we have to finish all of these things as part of a planning exercise before we're out the door delivering virtual care services? Well, the reality is that many of you may be delivering different forms of virtual care through your organizations already. For some of you, this may be entirely new, but you may be under a pressure to move quickly because of the current environment. In an ideal state, of course, you would like to proceed through all items of the checklist in order to have a comprehensive and risk-managed plan to implement virtual care. However, if that isn't possible and doesn't meet your reality, you at least want to now, at the stage that you are at, take a go through the checklist to be able to look back and adjust any practices that you may be engaging in currently, or to be able to identify key risk items that you want to address before you go out the door with the rest that can follow as you're doing things together in implementation. So what's on this legal checklist where it's up in front of you? And there are 6 things we're going to talk about together today as what we consider to be the necessary action items. The first is conducting an enterprise risk assessment. Second is identifying and evaluating the virtual care platforms that are available. Third is confirming the health practitioner regulatory requirements that will be applicable to your organization and the professionals delivering care on your behalf. Fourth is establishing an organizational virtual care policy. What should be in that policy and what do you need to be considering? Fifth is obtaining client and patient consent. What does that need to include, and how do you go about obtaining and documenting that consent? And sixth, and certainly not the least of which, is assessing and obtaining requisite insurance for virtual care modalities of delivery. So to start with, the first item on our legal item action list is enterprise risk assessment. Using technology to deliver virtual care services will introduce a host of new risks for the organization. And it's important as part of your virtual care planning that you are looking at it from an enterprise-wide perspective. What does that mean? That means that you are looking at it from a 360 view across the organization of what the potential impacts and risks are of engaging in virtual care. Now, when we talk about enterprise risk and engaging in risk assessment, the purpose of this is not to deter you from moving forward with virtual care. It's not to identify barriers to proceeding with virtual care. It's intended as a proactive risk management tool that you can use as an organization to identify the risks so that you may appropriately mitigate them and manage them in the manner in which you are implementing your virtual care initiatives and delivery. So a simple enterprise risk management approach looks at 3 levels of consideration. The first is, what are the various potential risks that you need to be aware of? The second is saying, well, now that we've identified these risks, what's the likelihood that they're actually going to occur and the potential impact that they could have on the organization? Not all risks are equal, and you want to be able to assess what is something that is a low risk, low impact for you versus something that is a high risk, high impact that would be in the category of ensuring that you've addressed and mitigated or managed in order to move forward. And that, of course, lends itself to the third phase of enterprise risk assessment, which is looking at those risks that you've identified as high likelihood or high impact and determining whether and how they can be mitigated or managed through your virtual care planning. It all sounds very theoretical, right? So let's put that into factual context when we're talking about virtual care. What are the variety of risks that might apply in the context of considering a virtual care initiative? And you see a visual there on the slide. I do want to highlight for you that we're providing these by way of example. So it's not intended to be a comprehensive list. There may be other risk areas that pertain to your organization. And as well, not all risks may apply to each organization equally. So whereas some of you may have higher risk in some of these areas, you may have lower risk in others. It's not a one-size-fits-all, which is why it's extremely important that you're engaging in a local organization-focused assessment in doing your own planning. But this should give you a tool, it should give you a foundation and a starting point for at least the types of questions that you should be asking yourself when you're engaging in an enterprise risk view of your virtual care initiatives. And so what are some examples of the questions that you can be asking yourself in each of these potential risk categories? Well, for governance and leadership, you would want to ask yourself, does your leadership team have knowledge and experience with virtual care and the use of technology? Now, for those of you who are participating today who are larger institutions and organizations, you will have more robust teams in place, perhaps an entire digital health or technology department or team that can embrace initiatives of this nature. I do want to caution you for larger organizations that it is important, even where you have individuals that are well versed in technology, that when you're approaching virtual care implementation, that it is not treated in that single silo, and it is still viewed and engages the entire organization in order to be able to comprehensively and ensure it's appropriately risk managed. For those of you that have smaller organizations with very lean leadership teams, you may want to consider whether you need to source some additional support or advice for the organization in considering the use of technology, selecting technology, and implementing it, if that is not an expertise that you have within your core team. Questions to ask in terms of legal risk: there are a variety of pieces of legislation that apply to the delivery of virtual care. We won't be going through all of these today, but Kathryn will certainly be speaking to some of them. And you want to ensure as an organization that you're asking yourself, what are those legal obligations that your organization must comply with in order to deliver virtual care? And so you want to look at those obligations both at the organizational level as well as at the level of the professionals that are engaged in the direct delivery of care. We listed a few of the pieces of legislation there: personal health information protection. We're certainly going to talk about privacy, as well as other pieces of legislation that are in the list there. And so you do want to ensure that whatever you're putting in place, that you've considered it from the legal perspective. Operational readiness. This is really a key aspect of your risk assessment before you're out the door with any virtual care modalities, is looking at what changes might be needed to your existing technology infrastructure, which is an item that is a natural consideration when you're looking at virtual care and selecting your modality and selecting your platform. But equally important in looking at operational readiness is also the business and clinical processes that you have in place. Because business and clinical processes that you use for in-person care do not directly or may not directly apply to the delivery of virtual care. They may need to be adapted and adjusted to reflect the fact that you are delivering care through technological means with a separation of space and potentially time. Human resources. There can sometimes be challenges in introducing virtual care within an organization. For some organizations that have joined us today, where we know that you have been significantly impacted by COVID-19, working with vulnerable populations, where you've perhaps needed to close your doors to direct or in-person treatment, you're looking at then a situation where almost your entire workforce is being forced into an environment where you may need to be delivering care or attempting to deliver care through virtual means. So it will be important to look at what are new workflows, roles, and responsibilities that will be required of your staff and health professionals, and what challenges you may face in terms of resistance, confusion, clarity, in order to implement those changes and your ability to implement those changes among a unionized workforce. Financial considerations. Virtual care can sometimes come at a cost and a price, depending on the technology and the platforms that you select and what has been in use in your organization in the past. And so an important consideration at the outset is looking at what are the capital resources that are needed in order to implement initiatives of this nature, not only from a technology capital perspective, but also in terms of other supports and services that you may require in order to both design your virtual care plan and implement it ultimately. And one of the things that Kathryn will also talk to you about this morning is specifically the topic of insurance that we wanted to highlight with you today. Standard and quality of care, I won't spend a lot of time on this except to highlight again to you, as we said earlier, it's the same standard of care that should apply. And so you want to be critically asking yourself and engaging your health professionals in the dialogue on what adaptations may be required in the way that clinical interactions are engaged with the patient or the client, and what could be the potential impacts on the quality of the care that are received by the patient or client through virtual means. You want to ensure that the patient or client has a clear understanding of that as well. Privacy and security in the virtual world almost goes without saying, but it can't, because it's one of the key components that needs to be examined very carefully at every stage of the process. Importantly, what are privacy and security safeguards that are additional that you may need or require in order to protect information? And we'll touch on this topic throughout the discussion together today. And last but not least on the enterprise risk pinwheel of risks that you may want to consider are the views of your stakeholders and the impact on those stakeholders. And this includes patients or clients. Will they be responsive to this new form of care? What are they looking for? What is convenient for them? What is going to work for them? This is where we look at the discussions that we have about engaging clients in co-design of initiatives that we're pursuing, including in virtual care. And we've had a lot of that discussion even pre-COVID-19 as we were talking about Ontario health team design and co-design and digital health initiatives. But stakeholders also include the community and include your funders. And an environment like we're in right now, which requires accelerated innovation, you may have the community and funders looking at your ability to adapt and your ability to be able to bring alternate modalities and approaches to care into the community in a swift but appropriately risk-managed way for both the patient and client and for the organization. Next on the checklist, we want to talk about identifying and evaluating virtual care platforms. So many of the items that were in the risk pinwheel are going to inform the various other items on the checklist, the action items on the checklist here. And so the outcome of your risk assessment, and when you're engaging in the risk assessment, you'll be engaging with a variety of the items that are here. And some of these are going to be your mitigation and management measures that you will in fact put in place. And one of those is around the selection of the virtual care platforms and what you're looking for in those platforms to mitigate and manage your risk and ensure that they are best suited for the organization. Now, virtual care or digital health platforms are sometimes designed in-house. You have innovative groups that are working on technology design and engaging in procurement processes for innovation procurement, where you're working on design. But more generally, and in times like these where we need to move forward swiftly, your virtual care platforms are going to generally be purchased or licensed from a third-party vendor. Those vendors or technology providers will have their own terms and conditions of use. And those terms and conditions of use, we want to highlight to you importantly, may limit the vendor's liability in the event of a privacy or security breach. This is of critical importance to your organization in being mindful of this, because these terms and conditions of use often arrive as a fait accompli, and they're really not. You need to pay careful attention to what's contained in them to ensure that you understand the deal and terms and conditions to which you are signing. To deliver virtual care services, it is entirely likely that there may be personal health information that will be conveyed through the virtual technology. So again, here we come back to the importance of privacy and security. And it's essential that you are assessing the privacy and security measures and responsibilities that your vendor is agreeing to assume. Actions to take when selecting a vendor. You want to obtain a privacy impact assessment or threat risk assessment for any new systems and platforms that are going to be used. You want to ensure that you are reviewing the privacy and security policies, both of your own organization as you embark on virtual care, but importantly, also having that understanding of what are the privacy and security policies of the vendor that you are selecting, and the potential impact and risk profile from a privacy and security perspective. Those terms and conditions that you will get asked to sign to, you want to ensure that they include a contractual representation from the vendor that the technology is compliant with privacy and security law. We have come across situations more than once, unfortunately, working with many of you, where the vendors either don't have a full appreciation of what their privacy obligations are at law, or attempt to disclaim or not assume full responsibility for those obligations. And that opens your organization to a significantly increased risk profile in engaging in virtual care. And so it's critically important that you have your eye on this issue. Importantly, you want to also know if your vendor will be accessing or storing any of the personal and health information that will be passing through the technology. And if the answer to that question is yes, you want to know how, and you want to know where. Related to that access is the technology support that you may be receiving. And you want to have a clear understanding of the physical location of the technology support personnel. Many of these virtual care technology companies and platforms that you will be using are companies that operate across borders. And so if the technology support personnel are residing in a different jurisdiction, you need to have an understanding of that from a privacy and security perspective in the event that they will be accessing personal health information, so that you can ensure that there are appropriate safeguards and measures or requirements in place in that regard. Often the terms and conditions do show up like the fine print. And that fine print of the vendor terms and conditions, it's really important that you don't assume them as the form of agreement that they're often presented to you as. They may contain in them limitations of liability that could provide great protection to the vendor, but could have significant legal and financial impact to your organization in the event of a breach. So you want to ensure that you have clarity of that understanding. And where you have a vendor that's indicating that they will not negotiate terms and conditions and that this is their standard form, well, then this should form a critical part of your assessment as to whether or not that is the appropriate vendor for you. Because if the terms and conditions of what they are providing do not comply with privacy law and security safeguard requirements, if they have significant limitations and liability, then you may want to look at alternate providers for those platforms if you can't make adjustments or negotiation to those terms. Ultimately, don't just accept what you're handed, and make sure that your interests in these terms and conditions that we've talked about have been addressed before you commence use of these platforms. So to continue on with the rest of our legal action items checklist, we still have 4 items to take you through today. I'm going to turn the floor over to my partner, Kathryn Frelick. Over to you, Kathryn.
Thank you very much, Karima, and good morning, everyone. The next item on our legal checklist is confirmation of health practitioner regulatory requirements. And this is one component of the enterprise risk legal analysis that we recommend that you undertake. Each organization must be aware of and review any regulatory requirements that may impact on the delivery of virtual care services. Each regulatory college has its own standards and guidelines related to virtual care, and there are differences in what those the approaches to this type of care. They are often technology neutral, though in some cases, some colleges do not allow for virtual care, or they do not allow for certain modalities to be used for that particular profession. So for example, they may not allow health practitioners to use text and email as part of the virtual care toolbox. You are, as we said, responsible as an organization for the care that's provided and for establishing systems, policies, and practices that support your health practitioners to meet their professional obligations. I think we skipped a slide. Thank you. Some of the common requirements for virtual care that we see as a common theme in many of the regulatory guidelines are listed below. This is, again, not a comprehensive list, but there is some commonality in the approach. As Karima mentioned, the standard of care for delivering virtual care services is the same as when you are delivering in-person services. So it's really important to make sure you undertake a cost-to-benefit analysis when you're looking at those services and ensure that the benefits of providing those services outweigh the risks, and that it is in the best interests of your clients or patients. When you are providing virtual care, there is an established practitioner-patient relationship. You owe a duty of care to that individual. The requirements for consent, for privacy, and for record keeping and documentation are the same regardless of the modality that you use. And record keeping is a very important consideration in terms of what information you gather, how it is documented, and whether you're able to keep it in the legal record for the client. The use of professional judgment to ensure virtual care services are appropriate in the particular circumstances of the patient or client is a key tenet of regulatory guidelines, and ensure that there is the technical competence on the part of the practitioner to be able to safely deliver virtual care. And that may include having backup or contingency plans in place in the case that there are issues with the technology, and having a process in place if there's an emergency or if there is the need for the individual to come in for more immediate assistance. And then finally, the obligation on the practitioner to ensure that there are reasonable safeguards in place to protect confidentiality and privacy of personal health information. When we are obtaining informed consent for treatment, it's also important to ensure that you are communicating information relating to the risks that are inherent in using technology. What are the differences between virtual care versus in-person care, and what are the additional privacy and security risks that are associated with any time you use technology to communicate information. And then finally, the location of the services may be restricted to the jurisdiction where the health practitioner is licensed. So it's very important to look at the particular college's policies around licensing and registration. If virtual care will be delivered to patients or clients who reside outside of Ontario, does that trigger additional licensing requirements in other provinces? In each profession in each jurisdiction is different. And unfortunately, we don't have at this point, don't have coordination amongst the various colleges as how they treat the licensing and registration requirements. So you really do need to look at it on a case-by-case basis. The next item on our legal checklist is the importance of establishing organizational virtual care policy. When we're talking about virtual care policy, you may have policies that are already in place that need to be updated or enhanced, or there may be additional policies or elements that you need to consider to ensure that you are setting organizational standards and requirements for the use of virtual care. The standards should apply to virtual care that's delivered either by your employees or contracted health professionals. And they are important in establishing consistency in the approach to the delivery of virtual care. The establishment of systems and policies are a really important risk management tool for the organization to establish the parameters around how these services will be delivered. So what might the virtual care policy include? So it may include the identification of virtual care modalities that are approved for use. how they can be used, and for which purposes. The organization, at the organization level, determining what platforms or modalities your providers will use, whether they are video visits, telephone calls, or remote monitoring. And if they are being used for a limited purpose or in certain circumstances. And certainly with the COVID-19 pandemic, we are certainly looking at the provision of virtual care in an accelerated fashion, and in circumstances where you might not have envisioned it in the past. So identifying for your staff what those modalities are, when it's appropriate to use them, is very critical. When we're talking about email and text messaging, your policies should establish how you may use those within the organization. There are many organizations that restrict the communication of personal health information through email and text messaging, where they are not secure forms of communication. There are ways to use those as very effective tools, provided that they are encrypted and the client consents and they are secure. But even where you don't use them for the delivery of healthcare, they can be a very important communication tool. What is your internal process to engage in virtual care? So some of these questions that you need to ask at the organizational level is, where will health practitioners be delivering services? Will they be delivering them remotely, or will they be on site? Will they be using equipment and technology supplied by the organization, or will they be using their own devices and computer equipment? If they are working remotely, what are the approvals that are needed, and what are the expectations to ensure privacy and confidentiality? For example, is there an area where they can work that is private, where they can have the necessary discussions with clients? Do they have the appropriate technology and in order to be able to provide that care? And is there an approval at the manager level to ensure that you're confident that the individual practitioner can safely and appropriately provide virtual care? The required safeguards to protect privacy and security of personal health information go both ways. So it's not only the setup that you have as the care delivery team, but also ensuring that your clients are able to receive information in a secure manner. For example, not using public Wi-Fi or other or communicating in an area where there isn't any privacy. Your virtual care policy can also set out responsibilities for your health practitioners. It should include the process for engaging patients and clients and ensuring that the resources are in place to safely deliver virtual care. Does the client have access to the necessary technology? Are they able to use it? Do they need communication assistance or interpretation assistance? Are they do they know what to do in the event of a service disruption? Are they is the technology that you're using of sufficient quality in order to provide safe and effective care? The policy should set out the process for obtaining consent, and also set out what your organizational documentation requirements are. And leading into that, we're now going to speak a little bit about the consent process and how that differs in the virtual care environment. So again, going back to first principles, the organization is responsible for having a process in place to ensure there is informed consent to treatment and knowledgeable consent from the perspective of personal health information. The health practitioner who's proposing treatment must obtain the individual's informed consent in accordance with the Healthcare Consent Act principles, the material risks and benefits, any side effects, the alternatives, answering any questions, ensuring that they have the information that they need in order to provide an informed decision. As we've said numerous times, obtaining informed consent to virtual care must meet the same requirements as in-person care, but there are the added risks and limitations that individuals need to be aware of and understand in order to be able to provide informed consent. And what are those risk considerations? Some of those issues that you'll want to review with clients and patients are the nature of the services that are being offered virtually, what you are able to do, and importantly, what you are not able to do. What are your limitations on confidentiality? Are there things that if they come up during a session, you will need to refer them to another service or to another, or insist that there's that you switch to an in-person modality. They should know that you are relying on the accuracy and completeness of the personal health information that they provide, and ensure that there are either provisions in your consent form or an understanding that there's no guarantee of the technology, of security and confidentiality of their personal health information, and there is no, there are certain things that you cannot take responsibility for, including technological issues. The patient and patient or client should be advised of any precautions that they need to have in place to ensure that there aren't other individuals in the room, or that the session is not interrupted. And then very importantly, advising clients about your availability and the response time for virtual communications. Just because we are making these services more convenient doesn't mean that there's someone available to be providing the services all of the time. And especially when you're dealing with email or electronic communications, knowing that it must not be used in emergency situations, and that you won't be monitoring it or responding at all times are very critical to communicate so that expectations are managed. A few words on obtaining client or patient consent. Consent can be implied or expressed. When you are using virtual care technologies for the first time, we do recommend that you obtain express consent. That can be in writing or it can be verbal. And there can be, sometimes it's difficult to be able to get written consent where you are primarily working in a visual modality. So there are a number of different things that you can use to ensure that individuals are aware of the risks and the limitations. You can use information sheets or handouts. They can be sent to the individual ahead of time. You can use checklists that identify the areas that the health practitioner ought to be going through with the client or the patient ahead of time or as part of the process. You can use a script that's developed that health practitioners can go through to ensure that they are identifying all of the important factors and identifying that the individual has provided express consent verbally. It's important to consider the use of interpreters and other communication support. The technology that you use itself, that's a consideration for the type of platform that you might use. The use of interpreters can change the dynamic. It can change the pace of the interaction, and it can, there are needs of the interpreters who are providing the service to be able to provide it in a consistent manner. Consent forms should be retained on the patient or client's health record in the same manner that you would for in-person care. Finally, the last item on our legal checklist relates to insurance and assessing and obtaining insurance that can address the types of risks that we are dealing with when we're dealing with virtual care. The increased privacy risks to the organization when providing virtual care may be due to the technology itself, as well as human error. And as you know, human error is very often the culprit when we are dealing with these types of issues, whether it's on the part of the organization or on the part of the patient or client. When you're dealing with mobile devices, information or laptops, information can be stolen. We all know that there are healthcare organizations are at increased risk of cybersecurity threats, including ransomware, which can disable information, can encrypt information so that you aren't able to use it, or where they're actually taking that information and using it for nefarious reasons. Organizations may be exposed to significant cost and liabilities, as well as disruption to their business operations. So it's an important bucket of risk that you should be looking at whenever you're introducing new technologies. When Karima was talking about enterprise risk management, insurance is one of the mechanisms that we can use to mitigate or transfer risk. And so that's really what it is intended to do. When you are engaging in new initiatives, you should check to make sure that your insurance policies provide adequate coverage for the delivery of new models of care. And your virtual care planning should include an assessment of existing coverage and identification of additional coverage that ought to be obtained, as well as any exceptions to coverage so that you can mitigate those risks. There are a variety of cyber and privacy insurance policies which exist in the market. Just in terms of the types of coverages that may be available, there are those that we put under the bucket of first-party costs or expense coverages that assist an organization if there's a need for notification of patients, the forensic investigations that may be necessary to address a cyber threat, legal expenses. It's important to contact legal counsel as early as possible when you're dealing with a potential or actual breach to establish solicitor and client privilege over your investigation. And in many cases, legal counsel can act as your breach coach. Some of the other types of coverages are for data restoration, bringing in crisis management to assist with your communications, and addressing cyber extortion. Most of us are more familiar with the third-party liability coverage, which addresses situations when there's when you're sued by a third party, whether it's privacy or defamation or network security liability. So with that, there are many opportunities now more than ever to advance innovative models of care delivery. We have set out a legal checklist of items that are some of the planning essentials when you are adopting virtual care. And as with any new initiative on the part of the organization, new models of care should be evaluated to support risk-managed planning. We want to thank you very much for joining us today. If you have any questions, please feel free to contact Karima or myself, and we would be delighted to answer any questions. Thank you very much for attending today, and and stay well and stay healthy.